Hello and welcome, my friends. I'm Dr. SAPTARSHI coming back to you with another very interesting session here today. One of the very common things which you'll hear in homeopathic parlance as a homeopath or as a layman as well is the word suppression. So I'm going to share with you some of the nuances of this word suppression, how it is practically applicable and what it actually implies. I'll give you a lot of references today of and about suppression. And I'll start off with the reference of Dr. S.P. Dey, one of the very eminent homeopaths from this part of India, Bengal. And he mentioned quite a few aspects about suppression. If you think, what is actually suppression? What does suppression mean? There are two aspects of it. If you think of a sudden cessation of a physiological phenomenon, or there is forcible removal of natural disease manifestation. So either it could be a sudden cessation of a physiological phenomena, or there is forcible removal of natural disease manifestation. So sudden cessation, I'll discuss that in detail, of a physiological phenomena, or a forcible removal of natural disease manifestation. So if we incorporate these two aspects, you can say it is the definition of suppression, and the forcible removal is before actually the disease is getting cured. So you have to understand these are the two aspects of the definition of suppression. Now if you try and understand what are the types of suppression, you can get a natural suppression and you can get an artificial suppression. A natural suppression and artificial suppression. Now what do you mean by natural suppression? If you think of all the natural events which a human being is exposed to, it can be fear, fright, it can be humiliation at office. Your boss is humiliating you, but you cannot express it. You're suppressing your emotions inside. Humiliation, suppressed anger towards your parents, towards your dominating partner. Those are natural suppression. You're suppressing your sexual desire, no sexual partners. Natural suppression. Even if you consider the physical aspects, you got sweaty and you came back into a chilled air conditioned room, you're suppressing your sweat. So these are all the form of natural suppression. All your natural secretions or your natural emotions are getting suppressed, and that is natural suppression. And that will gradually lead to symptoms in course of time. I'll share with you a few words from H.A. Roberts. The chapter is suppression. And H.A. Roberts mentions that all these forces have an influence on the vital energy. They suppress and warp the natural functioning, and a train of symptoms is produced. So when these natural emotions, natural secretions are suppressed, it will suppress your natural functioning. Symptoms get produced in that way. So that is one of the forms of natural suppression which you have to understand. Now, if you consider artificial suppression, what is artificial suppression? If you consider all the massive conventional medicines, all the massive allopathic medicines which are given over time, which have a direct toxic effect, which have a direct harmful effect, but there is no curative action, there is no therapeutic action, and that encompasses the aspect of artificial suppression. Now if you consider what are the types of artificial suppression, or how will you categorize artificial suppression, again sharing with you from H.A. Roberts. If you don't have this wonderful book, if you are a homeopath, you must have this Principle and Art of Cure by Homeopathy by H.A. Roberts. Is a wonderful writing to understand the philosophy of homeopathy. Principle and Art of Cure by Homeopathy by H.A. Roberts. Now if you consider that our types of artificial suppression, one of the very common things in today's world is painkillers. You have a headache, you take a painkiller. You have a joint pain, you take a painkiller. And you know what happens when you take a painkiller? Again, I'm sharing with you, it's not my words, it's words from H.A. Roberts again. The present day painkillers such as aspirin and the consequent indiscriminate use of it is exceedingly harmful. It suppresses the danger signals of pain. So pain is the expression of the vital energy. Pain is the expression of your immune system that yes, I'm ill, I'm not well. And when you are suppressing the danger signals, when you are suppressing the pain, you are only suppressing the natural expression of your immune system, natural expression of your vital energy. What happens as a consequence of that? It renders it possible to appear in a more exaggerated form, more dangerous manifestation in some other organ, or in a more serious condition in the same organ. So when you are suppressing the danger signals, when you are suppressing the pain with painkillers, conventional paracetamols, aspirins, what happens? You are suppressing the danger signals of pain, and it will only dwell the disease inward and inward and inward. So painkillers is one of the commonest and unfortunate abuses which results in suppression in the modern day world. So before you use a painkiller, before you use an aspirin next time, remember, you are suppressing the expression of your immune system, you are suppressing the expression of your vital energy, and gradually it will either resort to the dangerous manifestation in the same organ or in another organ, unfortunately. If you consider the second aspect of artificial suppression, one of the very unfortunate aspects of artificial suppression is surgeries. If you consider a common thing in today's world, especially for a common layman, you had a surgery for a gallbladder stone is removed, or renal stone is removed. 1 year, 2 years later, a stone develops in the common bile duct, a stone develops in the other kidney. You had operated in the right kidney, it came back in the left kidney. Why? Because you are only addressing the manifestation, you are addressing the end products. The patient has a tendency for stone formation, you are not addressing that. Only homeopathy can take care of that, so that the recurrence is addressed. You went to a pediatrician for your child's tonsils, you got the tonsils removed, comes back 3 months later with adenoids. Now you cannot remove one after another organ, because you're treating only the end products of the disease. Again, not my words from H.A. Roberts, I'll share that with you. A frequent form of suppression modern days is removal of disturbing organs by surgical means. Remember, this was written 100 years ago, but it's still valid in today's world. Again, forbidding the expression of the vital force through its chosen organs. The vital energy, your immune system is expressing its complaints through its chosen organs, where it has expressed itself in a disease state of the tonsils, the teeth, the sinus, or any other part of the economy. In removing the tonsils or other organs by surgical operations, we're dealing with the end products and not the vital energy. We're cutting off the manifestations of the disease and doing nothing to set in order the vital energy. We are not addressing how the immune system is compromised. You have to address the person so that his tendency to stone is addressed. You have to address the person so that his tendency to glandular affection is addressed. Because once you remove the tonsil, the compromised immune system will attack again through the adenoids, will attack again through the sinuses. You have to treat the person and not the disease, not the end products, not the manifestations. So constitutional treatment is the way always forward for such conditions in the modern day world. Third form of artificial suppression is suppression of the discharges. If you consider in today's world, one of the common things which is very often used is oral contraceptive pills. Patients who have been on OCPs for years and years and years, the natural menstrual cycle is affected. The natural menstrual cycle is suppressed. Women on IUDs, intrauterine devices, they haven't had periods for 3 months, 4 months. And you're suppressing the natural secretions of the body only to result in more devastating complaints later on, which can appear over course of time. So you have to address that as well, which is again one of the very common fallacies in today's world. Another one of the important things you must admit and address is the common day conventional medicine in today's world. And when you understand the common day conventional medicine in today's world, you have to understand that one of the factors here is the word metamorphosis. Why I am saying metamorphosis? A child 10 years old, 11 years old, you give him anti-allergics, antihistamines for his dust allergies. He goes well on antihistamines for a few years, comes back later with a very chronic cough. You treat that chronic cough, you give him inhalers. In his 20s, in his 30s, as time progresses, that cough transforms into a very severe bronchial asthma. But the inhalers cannot take care of it anymore, and you need to put the patient on steroids. So as time progresses, the dosage, the severity of the conventional medicine increases, and you put him on conventional medicines, more stronger and stronger and stronger over time, till at time the constitution cannot take it anymore. So the metamorphosis from a simple dust allergy to a chronic cough, and ultimately to a incurable, inveterate bronchial asthma, is one of the unfortunate truths of artificial suppression. Also, one of the things you have to understand, SPD mentions it in his chapter Suppression, that a child was born and few years later it develops atopic dermatitis or a fungal infection. You treat it with antifungals, it gets better. In his teens, he develops an eczema. Again, you treat it with conventional topical applications, gets better. In his 30s, in his 40s, now he develops psoriasis. And you treat the psoriasis with strong anti-conventional medicines or steroids. Psoriasis got removed. And in his end years, he develops a skin cancer, a malignant melanoma. So you see how the metamorphosis from a not so severe disease to a completely incurable disease is what happens with conventional treatment in many cases. People with cancer in their 50s and 40s ask me, I do not smoke, I do not drink. Doctor, can you tell me how I got cancer? And SPD has an answer for that as well. SPD mentions in his chapter on carcinosin, and I'm reading this, system tries its best to save us, but series of suppressions one after the another. So you're having conventional painkillers day in, day out. You're having lots of steroids. You're having lots of topical applications day in, day out. The system tries its best to save us, but series of suppressions one after another ultimately compels it to revolt. The consequence of such unified rebellion is rapid mitosis and carcinomatous growths. So even if you're a non-smoker, non-drinker, you're non-addicted, but when you look back at your own lifestyle, your own life history, you have taken painkillers throughout your teens, you have taken inhalers, you have taken steroids, and that suppression of the common diseases, of the common ailments, of the non-difficult ailments, gradually results the disease to progress inward and inward and inward. And that's one of the unfortunate truths of artificial suppression you have to understand. And therefore that word metamorphosis becomes even more relevant. Now again, you have to understand, when you understand the word metamorphosis, that how the pathology progresses. You have to understand the progression of pathology. You have to understand that initially your vital energy, your immune system tries to put the disease in a less important organ. So you develop a skin ailment, you develop an ailment of the gastric, you develop an ailment of one of the joints. So it tries to put itself, the first organic manifestation is generally in a less important organ. If you keep it untreated, the pathology progresses. It goes to its natural course of progression outward to inward. So from a less important organ, it goes to a more important organ. The vital organs, brain, heart, kidney, lungs, liver, those are affected in course of time. So when you keep a person untreated, this is a natural course of progression from a less important organ to a more important organ. An organ which won't damage your life, which won't threaten your life, to a very important organ where your life is threatened. Similar is the course of progression when you are treating with strong conventional medicines. You had a skin ailment, as I mentioned, you had a common pain, you're suppressing it, you're removing it with painkillers. Gradually from a less important organ, the pathology progresses to a more important organ. So this is the course of progression of pathology. If A, you're untreated, B, you're treating with strong conventional medicines in today's world. Again, I'll give you another example. This is from Stuart Clo. And Stuart Clo mentions in his chapter Life, Health and Disease. Stuart Clo is a wonderful read, philosophy. The name of the book is Genius of Homeopathy. And he mentions this, that the suppressed state always goes bad. Patient is suffering from an anal fistula. I'm sure many of you hearing me have had, or you know people who have suffered from anal fistula. And when you operate that anal fistula, when you operate that hemorrhoids, Stuart Clo's words again, abscess and fistula act as if they were the vent or exhaust of the disease, affording temporary safety to the vital organs. So it's still in an outer area, outer organ, but it's not affecting the important vital organs. So it's like a safety or vent or exhaust which is affording safety to the vital organs. Once you remove this with surgery, the fistula is removed with surgery, what happens? You're closing the exhaust, you're closing the vent, and an explosion occurs. So these diseases, therefore, temporary relief, safety to the vital organs till you're getting them treated. Obviously, if you leave them untreated, it will progress to an internal disease. But once you keep it untreated, if you get it treated with homeopathy, you'll obviously remove the tendency. But you have to understand, again, reading this again, you close the exhaust, explosion occurs. It affects the important vital organs. Patient comes down with a heart disease. You find so commonly fistula was operated. It might come back again in a very severe incurable form, as I mentioned earlier. Patient who have had surgery for fistula is recurred again and again. But B, once the fistula is cured, patient tells, I'm very happy my fistula is removed by surgery. They come down few years later with a severe palpitation, heart disease, or a long-standing incurable bronchial asthma.